We are progressing on the topic of neonatal sepsis. So this one we're just trying to look at the sources. If we're saying something like neonatal sepsis exists, what are the possible ways in which a child could actually contact an illness like this? So for neonatal sepsis, the possible places or possible causes of neonatal sepsis, of course we know neonatal sepsis, right? An infection in newborns that are within the first 28 days of life. Blood infections. Okay, so your body is kind of like reacting to it adversely. Okay, of course it's in a way of protecting itself, but you now have some side effects due to that reaction. So you can have microorganisms causing sepsis, like from bacteria. So bacteria is like what? Group B Streptococcus, Escherichia coli, Listeria monocytogenes, Staphylococcus aureus, Klebsiella, Pseudomonas, Enterobacter. All these bacteria are bacteria that are the most common causes of sepsis. Okay, they can have fungal infections from Candida species. You can have viral infection from Herpes Simplex virus, Cytomegalovirus infections. Okay, then sources of infections. Okay, these one are the causes, right? So let's look at sources. So it was actually supposed to be what? Causes and sources. So sources that's like where you can possibly get all these infections from. Alright, feeding bottles should be the first thing. Wow, feeding bottles is not here. So most of the times, women are not actually keeping a very good hygiene of the feeding bottles. Okay, so infections spread there easily. The maternal genital tract sometimes is passed during delivery. Transplacental spread. Sometimes the mother has the infection, so they spread it to the baby through the placenta. Sometimes it's contamination from amniotic fluid. Alright, then that's the early onset ones. Then for the late onset ones, maybe it's from the hospital environment. Maybe they did some surgeries for the baby, or they passed catheters for the baby. Do you understand? So you're having the infection coming later on. There's sometimes skin and mucosal colonization. So sometimes the baby is having a colonization of all those bacteria, but it's actually harmful bacteria. So risk factors that increase the likelihood of a baby having this contamination or complications. Maybe the baby is premature, the birth weight is low, maternal infection during pregnancy, prolonged labor, or membranes have ruptured for a very long time. Okay, then lack of prenatal screening, or maybe they have not given drugs to prevent group B Streptococcus infections. Okay, so this is what we have for the causes and sources of neonatal sepsis. Please remember that feeding bottle stuff that I was actually talking about.